Have you ever wondered whether using a vibration plate after a hip replacement can actually speed up your recovery, or whether it might interfere with your healing process and potentially damage the implant? As you know, this is becoming a very popular subject online in different forums, with some people swearing by vibration plates for balance, circulation, muscle activation, and it feels really good. But others often warn that you should never step on it after any form of joint replacement. So let's look at what the actual peer-reviewed research says. In this video, I'm going to break down whether vibration plates help after hip replacement, whether they're safe for the implant, when you might start using one, the pros and cons, and what I personally think for active adults in terms of what you need to understand before getting on it too soon. And as always, this video is for educational purposes and it doesn't replace your surgeon or physical therapist's guidance. What does the vibration plate do? It creates rapid mechanical oscillations. So when you stand on it or sit on it, your muscles need to automatically respond to those tiny vibrations, and your body makes small adjustments over and over and over again to help stabilize you. And that means the vibration plate is helping to stimulate your muscles, your tendons, your joints, your sensory receptors, your entire nervous system at one time. And this is called whole body vibration training. So lately, people are interested in vibration plates after hip replacement as an aid to potentially improve balance, wake up weak muscles, for better circulation, blood flow and lymphatics, bone health, faster recovery, reduced stiffness, and feeling more stable once again on the operated side. And many of these claims have legitimate scientific reasoning behind them, but people online often take a small amount of evidence and turn it into this one thing helps your hip to heal faster, and that's where we need to be careful and slow down and look at the actual research. Does the research show that vibration plates can help to accelerate healing after hip replacement? At this point, the evidence is limited and mixed. There's no strong evidence showing that the plates directly accelerate healing. And you have to take into account that most of the stronger research on vibration plates were done on older adults, those with osteoporosis, those in neurological rehab, and those with knee replacements, not so much with hip replacements. But there are some real potential benefits. And the first one is to balance and proprioception. This is probably the most promising area. After hip arthritis and or surgery, many people lose balance, a sense of body awareness, glute and hip stabilizing strength, and confidence loading the surgical leg, especially if they limped for years beforehand. I know I had a limp that I wasn't even aware of. A vibration plate can help here because your nervous system, again, has to constantly respond to the tiny oscillations. And this can help to improve postural control, proprioception, muscle coordination. And some studies in older adults showed improvements in balance testing and functional movement after whole body vibration training. And when I talk about proprioception, think of that as your body's internal GPS. So this is a way for your brain to know where you're stepping, or how much weight you're putting on a limb, or reaching your arm out to the side and knowing where it is without actually having to look at it. As you may be experiencing, hip arthritis often disrupts the whole nervous system long before somebody goes into surgery. Pain and limited range of motion changes your movement patterns. People compensate, you lean, you rotate, you unload one of the sides, and the nervous system then adapts to these patterns. And even after surgery, these old movement habits can remain. I know they did for me for a long time. And the vibration stimulus can help to wake up those neural pathways again. The second point is muscle activation. The vibration creates something called tonic vibration reflex. So basically this means your muscles are contracting automatically in response to those oscillations, which I've mentioned. And this can help to activate your entire body. So your glutes, your calves, your quads, the stabilizers around your hips, your core. And this matters because many hip replacement patients have what's called sleepy or underactive glutes after surgery. And even in active people, this can happen, especially if they've had compensatory patterns for years prior to the surgery. The third benefit is to bone density. So there is some evidence to show that whole body vibration can positively affect bone density in postmenopausal women. And this is fantastic news. So this is one of the reasons why the plates became so popular in osteoporosis discussions. But again, it doesn't automatically mean that it improves implant healing after a hip replacement. These are different things. A hip implant heals by a process called osseointegration, which is when the bone grows around the implant. And this process can take time, especially with cementless implants. Can vibration interfere with healing? Well, potentially it can if it's used too aggressively or too early, and this is where the nuance matters. Many modern implants are cementless. This means that the implant depends on bone growth into the implant surface for long-term stability. And during their early healing process, excessive micromotions into the bone implant interface is something that surgeons want their patients to avoid. And that's why surgeons always tell their patients early on to be very careful about impact, twisting, pivoting, unstable surfaces, or excessive force. When should you begin using one? This is where timing matters, and please, you must get your surgeon or physical therapist's approval, clearance, before using a vibration plate. In the early phase, up to 6 weeks, the swelling is still significant. Your tissues are healing, of course. Your balance is compromised. You may not be walking normally yet, and the osseointegration is still occurring. So usually in this phase, you want to continue walking, do gentle mobility, and begin to restore normal movement patterns. So this is not the time when you want to experiment with aggressive vibration. In the mid-phase, weeks 6 to 12, some people tolerate very gentle vibration, especially if your swelling is reduced, your gait is improving, your balance is coming back, and you have no complications. Now, in the later phases, 3 months and on, this is probably where the vibration plate will make the most sense for most active people. You have better tissue tolerance, less pain, and now the vibration plate can actually be useful to enhance circulation as a balance tool and supplemental conditioning. But still, keep in mind, it's not magic. It's not the only tool in the toolbox. All right, so if you decide that you're going to use one, here's how I would start. And remember, there is no high quality research saying that this is the exact program that somebody should use for a vibration plate after hip replacement. That doesn't exist, at least not yet. So here are recommendations based on the evidence that is available and certain rehab principles. Begin with 2 to 3 sessions per week, about 5 minutes per session. So that's enough to know how your body is going to respond without overloading the tissues that are still healing. And as your tolerance improves, you might gradually begin to build up to 5 to 10 minutes per session. I don't think there's much evidence that standing on a vibration plate or using it for 20 to 30 minutes provides additional benefits after hip replacement. So more isn't necessarily better. I'd rather have you take that time and do your walking, begin some gradual strength training and mobility, and practice your balance exercises off of the vibration plate. And keep the intensity conservative. So there should be an adjustable setting on the plate. You want to use a low frequency, and again, as I said, short duration to start. And in the beginning, you want to stand on both legs with your weight evenly distributed, knees soft. There's no need yet to perform deep squats, lunges, or single leg balance exercises until your strength and balance are better established. And pay attention to how you feel in the 24 hours after using the plate. Some muscular soreness or feeling like you did something is totally normal. But if you're having pain, discomfort, excess swelling, that's a clear indication that you've been too aggressive and done too much too soon. So like every part of this hip journey, and it is a journey, more isn't better. We want to progress slowly and steadily. Some days we're great, some days we don't feel so great. It is kind of an undulating curve, but we want to progress steadily in the right direction, and that just means you need to be a little patient. Keep in mind that the vibration plate is not a substitute for proper rehab. So even if you've had physical therapy and that has ended, the best activities you can do to continue healing properly are still going to be walking, slow, gradual, progressive overload, gentle mobility, and doing your balance exercises off of the vibration plate first. The plate can be a great add-on tool, but it's not the foundation. I didn't use a plate after either of my hip procedures, and I don't consider it to be a must-have investment, but if you don't mind spending the money, you're going to use it. It does have benefits and it does feel good. But if you just want a few pieces of affordable equipment, then what I would spend my money on is a progressive strength and mobility program that you can follow at home, a couple of dumbbells, a square stepper, bands, and a couple of kettlebells. That is enough to get you started and get you strong again, stable, work on your balance, and so many ways to use these few tools to get you back to strength and activities. If you want to find out more about my Hip Ease course that was created for active adults who are either considering, preparing for, or recovering from hip replacement, then see the link down in the description. And if this was helpful for you, please like, share, and subscribe. I'll see you at the next one.